Hello, my name is Frida Brown. The name of my project is Teaching Anxiety Reduction Strategies to ADN Students. I am working with first semester nursing students in an ADN program at a community college in the southeastern United States. I first started my project by conducting a needs assessment survey where I asked faculty and students the question, what can I do as a grad student that would be most helpful and supportive for you? And the overwhelming majority of respondents replied that anxiety is a really big issue for these students and that some tips for reducing anxiety or managing anxiety would be really helpful. This is also supported by a lot of research. A lot of research has been done on anxiety and nursing students. A little fun fact that I found is that nursing students report more anxiety than overall college students, and also more anxiety than students enrolled in other health professional programs. And anxiety can manifest as physical and emotional symptoms, and that this nursing students can experience higher levels of anxiety because there's a wide variety of difficult content to learn in the classroom, but also the clinical environment has demanding physical and emotional components as well. So, given that these anxious moments will be unavoidable, it is important for students to be able to have the tools to learn how to manage their feelings better. Also, the pandemic adds extra stress and anxiety to everybody's life. And so, having to adjust to learning in the environment now with the pandemic related concerns is another thing to factor into when considering how students experience anxiety and strategies for treating it and how to deliver this learning module. So, um, I decided to implement my module using the existing online learning platform that students are already familiar with. I'll be delivering this module as an online asynchronous module. This is also supported by evidence because it allows students to take the course at their discretion, which should minimize anxiety and consider, like I said, pandemic related issues with scheduling and resources and doesn't put any additional pressure on students. My innovation is based on social cognitive theory. The theoretical basis of social cognitive theory relies heavily on the relationship between personal, behavioral, and environmental factors, and it also emphasizes concepts of agency, motivation, self regulation, and self efficacy. One of the other reasons that my module will be voluntary is that students that identify that they need to control their anxiety will be able to feel like they are exerting control over their life, exhibiting agency and motivation in taking the course and learning strategies to help. So the resources will be evidence-based as well, using tools from the National Institutes of Health. The lecture will be delivered as an online slideshow, and it will contain a self-assessment for anxiety that is, again, provided by the National Institutes of Health. Self-assessment is important according to social cognitive theory because this is an essential factor in what drives behavior. So the lecture will be presented first, and it will be followed by my demonstration of modeling each skill. I will do 3 total skills, and it will allow time for the student to practice each skill in between my modeling of each one. I will also include probable situations where students could make the connection between using these behaviors and desired outcomes. So, personal nursing experiences and likely scenarios that they might find themselves in as students where they could apply each anxiety reduction tool. So, the intended outcome of this program is to promote self efficacy related to anxiety management. So these learning outcomes then will be assessing in the affective domain as their perspective on if their anxiety is being managed is really the most important thing. And hopefully they will then adopt these values and behaviors into their nursing practice. So the learning outcomes include, by the end of this module, the student will be able to identify the signs and symptoms of anxiety. They will be able to report confidence in their ability to perform these 3 skills, and they will report a willingness to use the skills in the future. So again, the self-assessment survey will be using an evidence-based tool provided by the National Institute of Health. Students will not be required to disclose, they won't even be asked to disclose the results of their survey because this is a privacy matter. However, considering the seriousness potentially of the results, I will be providing follow-up information for resources provided by the community college that are free and accessible for students for mental health support. Students will be using a 5-point Likert scale survey to state whether they agree or disagree to the learning outcome. And the benchmark for meeting the learning outcomes would be rating agree or strongly agree to the questions. At the end of the innovation, 1 week after, students will be emailed an evaluation where they can evaluate the effectiveness of the course as well as how the course went in their opinion. So they will first be asked to complete a 5-point Likert scale survey again, where the question is asked, do you manage your anxiety better after taking this course? And the benchmark for that will be 50% of students responding that they agree or strongly agree. Narrative comments will be allowed for evaluation of the instructor and the educational strategies and the resources provided. I will then be incorporating this data into a continuous improvement plan so that future iterations of this course can better meet the needs of the students. And I'm looking forward to hearing about everybody else's, and thank you for your time listening to mine.